So if you're a smoker and you've got surgery coming up, there's one huge pressing question that always seems to pop up. Today, we're going to tackle that question head-on, using a major new scientific review to finally get a clear answer.
Okay, so this is the big one, right? This is the question that causes so much stress. Your operation is on the calendar, maybe it's just a few weeks away, and you're thinking, have I missed my chance? Is it even worth the effort to try and quit right now?
You know, for the longest time, the answer was, well, it was a bit murky. There was this old belief floating around that quitting right before surgery could actually be a bad thing, maybe by increasing mucus or inflammation. But science needed a better, more concrete answer, which led to the real question: what does the actual evidence say?
All right, so to finally settle this once and for all, researchers didn't just dip their toes in the water. No, they went big to put this old idea to the ultimate test.
So get this. They didn't just look at 1 or 2 studies. They pulled together the results from 55 different scientific studies, all focused on this exact question.
And those studies, they covered the outcomes of more than 361,000 patients. I mean, wow. With a number that massive, you start to get a really clear picture of what's going on.
And this kind of massive investigation has a name. It's called a meta-analysis. You can basically think of it as a super study. It's designed to pool all the existing data together to find the definitive trend, giving us one of the most powerful and reliable conclusions possible in science.
Okay, so the stage is set. We've got this massive, powerful study. After sifting through all that data, what was the final verdict? Let's take a look at the real power of quitting.
The answer? An absolutely clear, resounding yes. It is 100% worth it to quit. And the amazing part is how fast the benefits kick in. If you quit just 2 weeks before surgery, you have a 27% lower risk of lung complications. Wait 4 weeks, and that includes a 33% lower risk of wound issues and, get this, a 14% lower risk of mortality.
Let's just zoom in on that first benefit for a second, your lungs. It's pretty incredible. When you compare someone who keeps smoking right up to their operation with someone who quits for just 2 weeks or more, that person who quit sees their risk of post-op lung problems drop by 27%. That is a huge deal.
And here's maybe the best part. It just keeps getting better. The benefits start piling up almost immediately. But the study found a clear pattern. The more smoke-free time you can put between you and your surgery, the stronger that protective shield gets. 2 weeks is amazing. 4 weeks is even better, and so on.
Now, this is all incredibly good news, but good science always gives you the full picture. So let's talk about an important dose of reality that the study also highlights, just to be thorough.
This is a quote taken right from the study's conclusion, and it's something we really need to understand. It basically says that even when you quit, some of the risks from having been a smoker don't just vanish overnight.
So if you put a former smoker's risk profile next to someone who's never smoked, the person who never started smoking still has the lowest overall risk for a bunch of different problems. It's just a stark reminder that the absolute best-case scenario is never to have started in the first place. But, and this is the most important but, let's bring it back to the real-world decision you're facing. The choice isn't between being a former smoker and a never smoker. The choice is between continuing to smoke or quitting now. And on that front, the evidence is crystal clear. Quitting dramatically lowers your risk compared to not quitting. That is the whole ballgame.
All right, so we've looked at the science, we've seen the numbers, now what? What do you actually do with all this information? Let's break it all down into a super simple 4-step action plan.
First up, quit as soon as you possibly can. The moment you get that surgery date, we know for a fact that even 2 weeks makes a massive difference for your lungs. Second, if you can, aim for 4 weeks. The data shows this is kind of a sweet spot where you see those big drops in wound problems and even mortality risk. Third, and this is so key, don't get caught in an all-or-nothing mindset. Any quit time is a win. Every single day counts. And finally, number 4, and maybe the most important of all, talk to your doctor. You are not in this alone. They have tools and resources to help you succeed.
So, let's wrap this all up. The science is in. The debate is over. It is never, ever too late to quit smoking before surgery. In fact, it might be one of the single most powerful things you can do for yourself. So knowing that just a couple of weeks can make a genuine, life-saving difference, the only question left is, what's your first step?